Here we are. Okay, thank you so much for your invitation to speak tonight, Jenny. I'm really excited to be here to speak on this topic. This is a topic that I'm really passionate about. I'm really passionate about midwifery care. And in fact, I wrote an editorial concerning this topic with Professor Deborah Davis for Women and Birth Journal recently. So if anybody wants to read that editorial, I'll share the link as well as a reference that they could access after this. Just to give our listeners some context, I am currently Assistant Professor of Midwifery in the United Arab Emirates in Abu Dhabi, where midwifery is not widely known. We currently have less than 300 licensed midwives in the country. And to give you some context, there are 30,000 nurses. So maternity care is predominantly given by obstetric nurses widely in the country. So this was a topic that was really interesting to me when we discussed the topic for tonight. And these are the objectives of my presentation. Let's see if I can change slide. So today, we're going to learn more about an understanding of what midwives do. And I'll be looking at that from an educational perspective and from a regulation perspective, and maybe more of a global context as well as and an educational context as well as what we actually do. I want to depict some public perceptions of midwifery, and I hope you'll find that interesting. And then we're going to move on to discuss some current global challenges which face us in midwifery and to debate the future of midwifery. So I went to my local gym earlier to ask some random members of the public who did not know me very well. They know my face, but they don't know me as a midwife. And I went to ask them, what do midwives do? So hopefully you can play the video now. Let's see. So I've come to my local gym to ask some people, what do midwives do? Let's see the answers.
Shoot.
Do you know what do midwives do?
Yes, I do. They assist in the birthing process.
Yeah?
Yeah, leading up to and during and after. They are there to support the mother and help give birth, I'm guessing.
Yay! Okay, so Martha, do you know what do midwives do?
They deliver children and look after the baby, well, give advice to the mothers and parents after childbirth.
Oh, very good answer. Okay, Alex, I have one question. What do midwives do?
What do? They deliver babies, I guess.
Yeah.
They do, don't they?
Do they do anything else?
That's all I know.
Okay, great. Thank you. Okay, Evie, can I ask you, what do midwives do?
Help with babies when someone's pregnant and how to go through the pregnancy and then during the pregnancy and after the pregnancy.
Good answer. Okay, so Mike.
Hi.
Can I please ask you, do you know what do midwives do?
Help with delivery of birth.
Yeah, anything else?
Support pregnant women when they need help.
Good answer, thank you. Hi Patrick, can I ask you a question?
Yes, of course.
What do midwives do?
They deliver babies.
Great answer. Anything else?
And they look after the wonderful ladies that give birth.
Do you have any experiences?
I do not.
Hi Anthony, can I ask you a question?
Yeah, no problem at all.
What do midwives do?
What do
Midwives do.
midwives deliver babies?
Yeah, anything else?
They deal with, God, this is harder than I thought. They deal with like the lead up to the birth, giving like parents and mothers advice.
Okay, thanks. Okay, so you can see that there's many different challenges in the public perceptions of defining what midwives do, and we have similar challenges in ourselves and actually defining what we do, especially here in the UAE where it's not widely seen, where midwifery is not widely seen. So I also looked up some images. I went to the internet and I searched what do midwives look like, and these are some of the images that I found. And if you're listening to the podcast, you can't see them, but if you're watching now, you can see that these are primarily white women, and there's various different images. There's very technological images, the image of a woman with a CTG. There is an image of a woman with a mask holding a baby. And there is a woman in a white coat with a stethoscope listening to the heart of a, I would say, toddler, maybe like a 3-year-old child on a woman's knee. So very varied public perceptions of what it is that midwives look like. This is what midwives look like. So this year was very exciting because we got to go to the ICM in Bali, which was a wonderful experience. And the passion and the energy for midwifery was really, really felt there. And you can see all of these wonderful smiling faces. And you can see that midwives have many different faces. They're from all over the world. These midwives are from Indonesia, from the UK, from Ireland. There's midwives here from the UK. You can see Sheena Byron there and Hannah. You can see midwives there from London. You have Jan and Sam and Camilla. Midwives from the UAE, we have the lovely Dr. Tracy and Caradine, who is one of our growing members of the midwifery education team here in Fatima College. She'll be joining us soon to educate the midwives of the UAE. We have midwives from India. There's Indy, and we have midwives from Canada, Danielle, and midwives from Ireland and from Saudi. There's Dr. Roa and Grania. And we have midwives from Burundi, including there are male midwives, so not all midwives are women, and that's a common myth or perception. We have midwives from Cardiff, Nikki and the girls from Cardiff, and midwives from France. So we have midwives from all over the world at the ICM, and I'm a big believer in that you can't be what you can't see. So if we're trying to recruit midwives and we're trying to grow midwifery around the world, we need to really grow our public perception to improve the public knowledge about what it is that midwives look like and what it is that midwives actually do. And you can see from, those people that I asked at the gym, they talked about midwives delivering babies. And you will see from the evidence that because of shortages of midwives, because of worldwide cuts of funding, and perhaps replacement of midwives with nursing, the public perception of midwifery is slightly skewed and has changed as well over time. So in the background of this slide, you will see an image of Called the Midwife, which is a really popular series in the UK. Maybe not so widely known in the UAE, but if you haven't checked it out, check it out. I'm sure it's available online. And this depicts midwifery in the 1950s in the UK. And I think that midwifery has changed an awful lot since the 1950s. It's gone through many different changes. And maybe that's a different perception of midwifery that the public will have. But we do have this beautiful definition of midwifery from the International Confederation of Midwives, which says that midwifery is the profession of midwives. Only midwives can practice midwifery. It has a unique body of knowledge, skills, and professional attitudes drawn from disciplines shared by other health professions such as science and sociology, but practiced by midwives within a professional framework of autonomy, partnership, ethics, and accountability. So it's a very responsible job. We have honed clinical skills, and we also have a particular philosophy and values which are particular to our profession. So midwifery is actually a very ancient profession, and it's as natural and critical to humanity as birth itself. It upholds and reflects the cultural practices of women and their families, and that's really important, especially when we're thinking of bringing midwifery into cultures like the UAE, where we're trying to introduce Emirati midwives. It's really important that we hold those cultural practices and value those cultural practices of women and their families. So this profession actually goes way back in time. It goes back as 40,000 BC. So that's how old this profession actually is. It's not new. However, we've gone through major challenges throughout history. Back in ancient Egyptian, Greek, and Roman times, we saw enormous progress in the development and acknowledgement of midwifery as an autonomous, scientific, and respected paid profession, actually, back in those times. But in late 300 BC, the social attitudes about female midwives changed, and midwifery became a profession under the hierarchy of male supervised medicine. So then when we went through the Middle Ages, we had this period where female midwives and healers were considered to be heretics or witches and would have been hung or burnt to death at that time. Fast forward then to the 17th century, and throughout colonialism, we saw periods where women who worked as skilled midwives in Africa were actually enslaved as midwives and brought to the US and other places to provide birth support until during the 19th century, when there was again a shift to male supervised obstetric medicine. And nowadays we're facing many different challenges with global variation in midwifery practice, and there's been challenges with our autonomy, our role and our legal status, unfortunately. So we have this lovely definition of a midwife, which again is from the ICM, and it states that a midwife is a person who has successfully completed a midwifery education program that is based on the ICM essential competencies for midwifery practice and the framework of the ICM global standards for midwifery education, recognized in the country where it's located, who has acquired the requisite qualifications to be registered and or legally licensed to practice midwifery and use the title of midwife, and who demonstrates this competency in the practice of midwifery. So you can see that this title, midwife, is actually protected in legislation, and that it should not be used by anyone else except anyone who meets this global definition. And I suppose traditionally we think about midwifery as a really happy role where we celebrate new life, but it is also very challenging because we particularly recently are facing issues like climate change, where we are facing global emergencies during catastrophes. And we also have many other different challenging situations, such as during perinatal care. And our role also includes working for women who are dealing with bereavement and loss. These essential competencies, which are outlined here by the ICM, can give you a general information about what it is that the midwives do. While there's general competencies that you can see under point 1, we focus on care throughout pre-pregnancy and antenatal. So we follow the woman through the pregnancy journey to when they're planning their pregnancy, giving them family planning information. We can care for them throughout all of their antenatal care. We also lead and provide labour care when everything is normal. And then, as Claire stated, we recognise when there are deviations from the norm and get relevant collaborative care when in a timely fashion when the need arises, and we're experts in recognising when there are deviations from the norm. And then we also have this ongoing care, which is the Cinderella service in our maternity care, which is the postpartum period, and we provide infant feeding support and support for women who are going through this transition to motherhood. So our role actually encompasses a wide range of skills and competencies, and this needs to be more widely recognised. So we have this fantastic body of work, which is the Lancet Midwifery series, which we really need to harness this to advocate for midwifery. This was published almost 10 years ago, and it was shown that more than 56 outcomes actually are improved when we implement midwifery. And we are moving from the Millennium Development Goals, which saw a massive success in reduction of maternal and newborn mortality, to the SDGs, which are looking beyond mortality to thriving and supporting women to have fulfilling births, respectful maternity care. And we're trying to empower women now to make informed decisions to achieve the births that they want and to make that transition to motherhood. So we're going beyond survival to actually thriving in motherhood. But we do know that midwives have the potential to save the lives of women and children at a scale unmatched by other health interventions. In the Lancet Global Health, Nove et al. Estimated that 67% of maternal deaths, 64% of neonatal deaths, and 65% of stillbirths in the 88 low-income and middle-income countries, accounting for the vast majority of these deaths, could be averted if we implement universal provision of care by midwives who meet international standards and are integrated into health systems in the context of multidisciplinary teams. So we call for urgent investment in midwifery to enable midwives to fulfill their potential, because we have this massive potential to save lives and to improve outcomes for women and babies worldwide. And we can also contribute towards this universal health coverage and SDG agenda. So again, coming back to the ICM, if we think about what it is that midwives do, this is our scope of midwifery practice. And this outlines particularly what it is that we do. And we've been working on this in the UAE recently. We were, myself and Dr Georgina were part of the national committee who updated the scope of midwifery practice. Dr Gina actually chaired the committee, and we're very excited to make some changes and to have an impact to really try and drive forward this agenda of ensuring that midwives can work within their full scope of midwifery practice, because this is a challenge that we're facing worldwide. So you can see there that we are accountable and we're responsible for what we do. We work together with women to give them the support, care and advice during pregnancy, labour and the postpartum period. We do conduct births, which is what the public perception that we saw. We do include preventative measures, the promotion of normal birth, the detection of complications in mother and child, accessing medical care and appropriate assistance, and also being experts in carrying out emergency measures. Importantly, I want to draw your attention to the final point on that slide, which says that midwives can practice in any setting, including the home, the community, hospitals, clinics or health units. And currently here in the UAE, home birth is actually illegal. And this is something that I want to tease out and to talk about tonight in my presentation. So you can see from my presentation so far that there is far more to what midwives do than the public perception. We do far more than simply deliver babies. So the next thing that I want to focus on is the fact that midwives are advocates for women and their newborns. We advocate for equitable access to midwife-led services for women because we know that midwives are the key to improving healthcare outcomes for women and their newborns during childbirth. We know from the evidence that sometimes we have interventions that are carried out too late, unfortunately, and more recently we're seeing evidence of interventions being carried out too much too soon. We're seeing skyrocketing cesarean section rates of 50 and 60%, and we know that midwives can make a difference when it comes to this, and this has implications for society at large. If we have cesarean section rates of 50 and 60%, this is going to have massive implications, and I think it's something that we really need to consider going forward for society and the climate and the whole planet. So again, coming back to what it is that midwives do, and a lot of what we do is actually watchful attendance. We are with women, we are optimizing physiological processes, we are reassuring them that what is happening is normal, and if it's not normal, then we're escalating appropriately. We're delivering individualized holistic care rather than a task-based approach, which I suppose as a nurse, this is primarily one of the big differences between nursing and midwifery, if we are to go there, that nurses are more likely to do things on a task-based way, whereas we are looking at the woman as a whole. We are coming at birth from the salutogenic approach, looking at this as a normal physiological process and something that most women will go through. And we provide care for all the multidimensional aspects of care, not just the physical, but the psychological, emotional, socio-cultural aspects of care that are important and that women value. And we also have a role in obviously supporting infant feeding as well. So I want to talk about tonight the role of the midwife in talking about choice of birth setting. Because globally, we see that women are fighting for the right to birth wherever they want to. And we're also seeing issues that women don't actually know their choice of models of care. And I suppose this is because traditionally women gave birth in many settings, including the home, but with increasing biomedical models where childbirth is viewed as risky, birth has moved to the hospital, and now the majority of women, the vast majority of women, are giving birth in hospitals because they don't know that they have any other choice. And we have seen removal of public funding for home birth. And this summer I've been to Australia. I've been to Southern Cross University as a visiting scholar in the Gold Coast. And I've been home in Ireland. I've met midwives at the ICM. And I'm seeing that this is a global challenge where women want to have home births. And unfortunately, there's been challenges in getting public funding. And we know that there's evidence of iatrogenic harm in hospital environments. That means that some women, when they go into hospital environments, it doesn't necessarily guarantee a safe outcome. And in fact, some of the interventions that we do can actually cause harm to women. There's also growing evidence that for some women, hospital may be more harmful than home birth. And we do know that women often will choose to free birth rather than give birth in hospitals. So we need to reflect as healthcare professionals on our duty of care to these women who have such great fear of us as a healthcare profession that they don't trust us anymore. And they see the outcomes, they see high cesarean section rates, and they are educating themselves. They have access to the NICE guidance, they have access to best practice. And they are fearful to give birth in our hospitals. So we need to reflect upon that and to think, how can we build this trust again, you know? So I found this study which looked at midwives' perceptions of midwifery, because an issue that I've noticed and that has drawn my attention is that majority of midwives these days are being trained and educated and practicing in hospital settings. So if we don't have perspectives or experience of home birth, how does that impact how we practice? And so this was an Australian study conducted in 2020 by Coddington et al. And it's entitled Seeing Birth in a New Light, the Transformational Effect of Exposure to Home Birth for Hospital-Based Midwives. And what they did in this study was they interviewed 21 midwives and midwifery managers from public hospitals with experiences of publicly funded home birth models in Australia. And they found, very interestingly, but unsurprisingly, that witnessing undisturbed birth at home transformed midwives' attitudes towards birth. So for some of these midwives, after they'd seen home birth, they felt they were seeing undisturbed birth for the first time. And when you witness birth, when you hear those noises, when you are with the woman and you observe her going through these stages, in her comfortable environment with the oxytocin flowing, in her safe environment with the midwife who was known to her, it's a very different experience. And these midwives actually questioned their current understanding of physiological birth, and it helped them to develop a new awareness of the powerful influence that the environment has on labouring women. And this understanding actually resulted in changes to their practice. So this is a diagram depicting the themes that were found in this study, which I recommend you to read if you're interested. So you can go to the full study. But the midwives described the transformational power of exposure to home birth. So these were hospital-based midwives, and they described feeling apprehensive, skilling up for home birth, and being supported and mentored, and bringing an international perspective when they made this leap from hospital to the home. They described the feeling of stepping into the woman's territory, witnessing undisturbed birth, and gaining this new understanding of normal physiological birth, which prompted them to change their midwifery practice when they saw birth in this new light. They described increasing interdisciplinary trust and building a trust in home birth. And this is something that we see worldwide, this kind of skepticism between home birth midwives and hospital midwives. Sometimes there's a bit of a clash, and how can we support each other? So they talked about building trust and developing this relationship. They talked about enduring scrutiny, and I think that's something that midwives will relate to. I'm sure the discussions after this might hit a nerve or stimulate discussion. They talked about being committed to keeping women safe. So they want to deliver a safe experience for women. And they talked about sustaining the model. And at the end, they felt that they recognized the benefits of publicly funded home birth. They felt secure. They felt they were networked in. and they felt that they avoided the drama of transfer through these increased relationships with the home birth midwives, and they talked about making home birth more accessible overall. So this was a really positive finding of the study. So what is this? I'm sure most of our listeners here, I hope most of our listeners and most of our people who are tuned in tonight will know what this silver instrument in the middle is. If you don't, maybe you should check one out. It's called the Pinard, and this is the midwives tool. You will see I have product placement there as well. I have the Maeve Midwifery book behind. So our past president, Franca Caddy of the ICM, she called for us as midwives to celebrate the work of the Pinard. She gave a beautiful presentation at the ICM this year, which was so inspiring. And she talked about the relationship that is built when midwives use the Pinard, and that this is a dying art and a skill which midwives must keep and must fight to keep this practice. And it's a symbol of midwifery, and it's a powerful symbol. And if we believe in midwives for a healthier future, we should be promoting this best practice to listen into the fetal heart. So I call on everyone here watching tonight to don your Pinard and to be really proud of your Pinard wherever you are tonight. So I'm going to move on now to some of the barriers and facilitators of midwifery worldwide, because we know that midwifery is facing lots of challenges. And the barriers are on the left and the facilitators there are on the right. So globally, we have a lack of recognition of the work that midwives do. And you can see that when we ask the general public, what is it that midwives do? They say delivering babies, maybe giving some support, but they don't recognize the wide amount and the wide scope of work that midwives do. And I haven't even touched on the work that midwives do in terms of leadership, education, working in policy, working in many different arenas, not just clinically. So there is work to be done in enhancing the public perception and the recognition of the valuable work that midwives do. The lack of an enabling environment, and we can talk about being under scrutiny, the ability to work in our full scope of practice. How are we actually facilitated to work within our working environments? If you're working in a hospital right now, do you feel like you can speak up? Do you feel like you can advocate for women? Or do you feel under pressure to do things within the system to keep people happy, as it were? We have to really consider this enabling environment. The lack of recognition of midwifery as a distinct profession, and I think here in the Middle East that is a real challenge for us, perhaps in the UK and in Ireland where it's really enshrined in law, and this is less of a challenge. But this can be for debate with Jenny afterwards. The overstretched midwifery workforce, and this has really come to the fore with COVID-19. We are going through burnout. We are going through a crisis with our midwifery workforce. People are feeling undervalued. They're feeling like they can't work as midwives in the way that they wish to. We wish to work in social models of care, moving out into the community. We wish to expand our full scope of midwifery practice, working in teams, delivering continuity of midwifery carer, prioritizing women's experiences. And because we're so overstretched, midwives are facing burnout, they're facing moral dilemmas where they feel like they're just not giving the care that they wish to. And this is a real barrier and a challenge to midwifery, because we are naturally compassionate people who really are empathetic and feel for the women and the babies that we care for. And sadly, a lot of midwives are leaving the NHS, and they're leaving the clinical practice to because they cannot face delivering what they perceive to be poor care. So how can we facilitate midwifery going forward? An association of midwives is a really positive thing. So globally, it's really important if you're working in a country where you don't have an association of midwives to try and get that group together. In the United Arab Emirates, we have a midwifery section of the Emirates Nursing Association, which is really supportive of the midwifery agenda. So we're very fortunate. We need to inform the public about midwifery. Perhaps we can have campaigns about midwifery. I do think that there's lots of documentaries which depict what we do as midwives. And generally, I think the public do really value the profession. Even if they don't know the full scope of what it is that we do, they do value us. We need to increase the awareness of the full scope of midwifery services, have midwives working in antenatal clinics, in postnatal care, working in the community, and increasing home birth services, midwife-led services, whether it's a freestanding midwifery unit, expanding all of the full scope of midwifery practice. We need more midwives, and the State of the World's Midwifery report found that we are short nearly 1 million midwives worldwide. So increasing midwifery education is a key component of that. If we can develop midwifery education, student midwives are the future midwives, and they are the future of midwifery and of healthcare for women and newborns worldwide. All of this is great, but unless we nourish our midwives and provide adequate support, we're going to lose them. So it's one thing recruiting them to the profession and telling them this is the most wonderful profession in the world, because it is. But we need to retain them. We need to pay them well. And finally, we need to collaborate with other professionals. So we do need to actually promote our profession within other professions as well, and recognise ourselves as a distinct profession. So we do need to advocate for midwifery. We can do this by sharing the evidence. Evidence is the way to go, and thankfully we have so much brilliant midwifery research, which is published now in international peer-reviewed journals. We have strong evidence and high-quality evidence to support the midwifery profession. And we have the women's voices. The women's experiences are going to drive change. The women will request midwifery care. In the UAE, where we just have new student midwives, they're already beginning to request care from a student midwife from Fatima College, because they know they have Emirati student midwives who speak their language, who understand their cultural needs, and their voices will drive this grassroots change which we need, because decisions made at an individual level impact people at other levels. So if we can make changes at this individual level, this will escalate to an international level. It will escalate from the community to the local authorities, to the provincial, to the national, to the regional, and to the international forum. So it's such a brilliant opportunity. And I have met some fantastic doulas, midwives, people in the birthing community this year who are really passionate about driving change. I think it's a really exciting time to be part of this profession. So I'm going to summarize my presentation tonight by saying that we have this fantastic profession of midwifery, which is important. It is delivering evidence-based care, and we are saving lives. And I will finish with the words of our past president, Franca Caddy from the ICM, who said that all midwives know when it's time to breathe and when it's time to push. This is our time to push for midwives.